Good evening, ladies and gentlemen. This is Dr. Paul. Thank you very much once again for tuning to our channel today. I want to talk a few minutes about obsessive compulsive disorder and its treatment. First of all, let us define obsessive compulsive disorder. What are the basic diagnostic criteria? This disease is characterized by obsessions or compulsions. Obsessions are persistent thoughts. They recur, and some of the impulses, whether they are just imagination or experienced in patient's life, so they come as persistent thoughts into patient's brain. And the thoughts and impulses or images are not simply excessive worries about real life problems, and person attempts to ignore or suppress such thoughts or impulses or images, and he tries to neutralize them. And also, person recognizes that the thoughts, impulses or images are a product of his or her own mind. Then there are compulsions. Compulsions are like repetitive behaviors like hand washing, ordering, checking, mental acts like praying, counting the same thing again and again, and repeating works silently that the person feels driven to perform in response to an obsession. So these are the basic diagnostic criteria for this disease, and it is most commonly seen in young adults. And this disease, although some neurologic findings have been associated with OCD, such as increased gray matter and decreased white matter on brain imaging, the diagnosis is a clinical one based on finding this obsessive and compulsive behavior in the patient. But let me talk about treatment in this short video. First of all, pharmacological treatment. We use, first of all, SSRIs. SSRIs are the first choice. Fluoxamine, fluoxetine, sertraline, paroxetine, citalopram, clomipramine, escitalopram. Those are the main medications among SSRIs used for this OCD. Then neuroleptics like risperidone, olanzapine, pimozide, ziprasidone, aripiprazole, haloperidol, and clonazepam. The patients do not respond. MAO inhibitors like phenelzine, phenylcypromine, venlafaxine, mirtazapine, trazodone, clonazepam. These are the main medications for this problem. And there are some non-pharmacological treatments, like interactive treatments include family therapy and cognitive behavioral therapy. There are neurosurgical treatments like limbic leucotomy, anterior capsulotomy, subcaudate tractotomy, anterior cingulotomy. And also there are some experimental treatments right now which are only in experimental stage. Plasmapheresis, immunoglobulin treatment, chronic penicillin treatment, and also intravenous clomipramine. So basically that's about it. The point you need to recognize is selective serotonin reuptake inhibitors, the SSRIs, generally are utilized first, with other psychotropic agents added if initial therapy fails. The optimal SSRI dosage for OCD tends to be higher than the dosage used to treat depression, and with an adequate trial of medication may take up to 12 weeks. So basically those are the main points. The things we need to recognize are patients with OCD. This disease commonly occurs in young adults, and it has a chronic variable course, and patients have the repetitive symptoms like hand washing and checking routines, and there are some changes in the brain, but basically this is a clinical diagnosis, and most commonly we start with SSRIs, and neuroleptics also have some benefit. Then we start with cognitive behavioral therapy, which is also useful in this disease. Thank you very much, and if you have any points, please add them in our comment section so others can also learn and benefit from them. Thank you.